Hi everyone. Today comprehensive questions. This is your endless nurses world. First question is largest and strongest bone of the face, mandible. How many doses of vitamin A is given to children below 6 years as per National Vitamin A Prophylaxis Program? 9 doses. Multipurpose Health Worker Program was started on the recommendation of Dash Committee, Kartar Singh Committee. Headquarters of UNICEF is at New York. Population coverage of community health center in hilly areas 80,000. A client's electrolyte report shows that serum potassium level is 2.9 milliequivalent per liter. It means hypokalemia. Which among the following is an ECG changes that can be expected? U waves are prominent and ST depression. Trocheus sign of latent tetany is a clinical test for which electrolyte abnormality? Hypocalcemia. A client who is at 26 weeks gestation arrives at the clinic for her scheduled examination. Her blood pressure is 150/86. She tells the nurse that she has gained 5 pounds in the last 2 weeks. What is the priority nursing action? The answer is test the client's urine for albumin. Increased blood pressure, weight gain, and presence of albumin in the urine. It indicates the signs of preeclampsia. What behavior does a nurse expect of a newborn about 1 hour after birth? Newborn will enter a sleep phase after 30 minutes after birth. So answer is relaxed and sleeping quietly. A nurse is providing dietary teaching for a client who is receiving a high protein diet while recovering from an acute episode of colitis. What should the nurse include is the rationale for this diet. Protein is required for the building and repairing intestinal tissues. Answer is repairs tissues. A nurse is caring for a client experiencing an acute episode of bronchial asthma. What outcome should be achieved? In bronchial asthma, bronchial dilatation and also the excretion of mucus, because the mucus will interrupt with the gas exchange. So answer is raising mucus secretions from the chest. When a developmental appraisal is performed on a 6-month-old infant, which observation is the most important to the nurse in light of the diagnosis of hydrocephalus? So 6-month-old child head lag is abnormal. It is a sign of cerebral damage. The answer is head lag. A new mother refuses to look after her newborn who has a severe birth defect. What is the nurse's most therapeutic approach? First, we have to reinforce the explanation of the handicap and allow time for her to discuss her fears. A nursing assistant interrupts the performance of a ritual by a client with obsessive compulsive disorder. What is the most likely client reaction? Inner compulsive is used to control anxiety. Any attempt to prevent the action will increase the anxiety. So answer is anxiety. A healthcare provider prescribes a diuretic for a client with hypertension. What should the nurse include in the teaching when explaining how diuretics reduces blood pressure? Diuretics it block the sodium reabsorption and promote fluid loss. This will causes decreased blood volume and reducing the arterial blood pressure. Answer is reduces the circulatory blood volume. A nurse is caring for a client who is receiving thiazide diuretic for hypertension. Which food selected by a client indicates to the nurse that dietary teaching about thiazide diuretics was effective. So thiazide diuretics are potassium depleting agents. Broccoli provides 267 mg of potassium per 100 gram. So broccoli is the answer. A nurse is caring for a client who attempted suicide. What is the most desirable short-term client outcome during this crisis situation? In a suicidal attempt, client safety is very important. After that, then no suicidal contract between the client's agreement and not to attempt suicide and to seek any suicidal emergencies. The answer is establishing a no suicide contract. A 3.5-year-old child is admitted to the hospital for an appendectomy. What should the nurse use to do best prepare the child for the hospital experience? To manipulate unfamiliar equipment, this tends to reduce the stress of hospitalization. So we have to give the child for therapeutic play. A client with adrenal insufficiency reports feeling weak, dizzy, especially in the morning. What should the nurse determine? In a deficiency of glucocorticoids causes hypoglycemia in Addison's disease. So mainly in adrenal insufficiency, hypoglycemia will occur. The answer is a hypoglycemic reaction. A client is admitted to the hospital with a diagnosis of chronic kidney failure. For signs of what electrolyte imbalance should the nurse monitor the client? Hypocalcemia in the blood because reciprocal relationship with the phosphorus. It is increased when the glomerular filtration rate is decreased. So hypocalcemia is the answer. During her 6 months of pregnancy, a woman visits the prenatal clinic for the first time. As part of the initial assessment, a CBC and urine analysis are performed. Which laboratory finding should alert the nurse further assessment is required? Her hemoglobin level is 10 gram per deciliter. Because lowest hemoglobin indicates physiologic anemia. 2 hours after an uneventful labor and birth, a client's uterus is 4 finger breadths above the umbilicus. After urinary catheterization, the fundus remains firm and 4 finger breadths above the umbilicus. What is the priority nursing action? Increased height of the uterus may result from accumulation of blood in the uterus from internal hemorrhage. So we have to first notify the healthcare provider. A client has a history of hypothyroidism. Which skin condition should the nurse expect when performing a physical assessment? In a hypothyroidism, the skin should be dry. Passivity of the thyroid hormones which control the basal metabolic rate. This will decrease the functions of sebaceous glands. It leads to the skin become dry. A nurse is caring for a client who has had an open deduction internal fixation of a fractured hip. Which nursing assessment of affected leg is most important after this surgery? Mobility of the toes assesses the neural integrity distal to the surgical site. So the answer is toes for mobility. A client is scheduled for emergency abdominal surgery. What is the priority preoperative nursing objective when caring for this client? First, alleviating the client's anxiety. What is the most important for a nurse to do when helping a new mother on the postpartum unit develop her parenting role? We have to provide time for her and her infant to be together. Parenting can begin only when the infant and the mother get to know each other. So we have to give time to meet mother and child. Healthcare provider prescribes famotidine for a client with dyspepsia. What is important include about this medication in a teaching program of this client? Famotidine inhibits histamine at H2 receptor site. As a result, there is decreased gastric acid secretions. The answer is decreases secretions in the stomach. Although a nurse is unable to identify any obvious signs or symptoms of bleeding, a client repeatedly has tested positive for occult blood in the stool. Which laboratory result is a concern considering this client's history? Hemoglobin level 8.5 gram per deciliter. A nurse is caring for a client with a severe gastritis who vomited a large amount of blood. A lavage is ordered by the healthcare provider. Which responses does the nurse expect when using a room temperature irrigating solution? Lavage removes blood from stomach and irrigation solution helps for vasoconstrictions. It helps to control the bleeding and limiting the flow to the area, blood flow. So answer is constrictions of blood vessels. A blood transfusion is initiated after client has had emergency surgery. What should the nurse do first when the client develops fever, chills and low back pain? So fever, chills, low back pain indicates the first hemolytic reaction. It is a life-threatening situation. So first we have to stop the blood and infuse saline. This is the answer. A nurse determines that the postpartum client is gravida 1 para 1. Her blood type is B negative and her baby's blood type is O positive. What should the nurse include in the plan of care? So Rhogam we have to administer to prevent the sensitization from RH incompatibility. Answer is obtain an order for Rhogam. While changing the newborn's diaper, a client expresses a concern about a small spot of red vaginal discharge on the diaper. How should the nurse respond to this concern? So this red spot due to maternal hormonal influences. It is temporary. The answer is explain that this is an unexpected finding. These are all about comprehensive questions. If you like this channel, you can subscribe to me and ring the bell button. You will receive my notifications, and you can see my previous videos also. You will learn lot of things. Thank you.